In this video, we're going to talk about how back surgery causes neuropathy to happen, or some things that we see all the time. So when you have back surgery, the two most common surgeries that people typically often have, one is called a laminectomy, where they remove the lamina. Now, for most people to know, the lamina is part of the bone on the lumbar vertebral spine that potentially could be pinching on that nerve. And two, they do a fusion. And a fusion is where they put screws and plates in to stabilize that area. One of the common problems that creates a fusion is that when somebody has what they call spinal stenosis. And stenosis is where the disc, and think of that as a gel-like material in between the bones that creates the cushion from the bone above and below. It basically gets squeezed out, and as it gets squeezed out, it gets pushed out. And once it gets pushed far enough, it actually starts to hit the spinal cord, and that's where it becomes dangerous, because the spinal cord is all the bundle of nerves that communicate and control everything in the lower body. So surgeons will go in and they will actually fuse that area. Well, a lot of times after the fusion or after the surgery, patients will often tell us that they had lost control of their legs, or they've got numbness and tingling immediately after the surgery. One of the hardest things, and surgeons are amazing at what they do, nerves are very tiny. And so what happens a lot of times is that nerves can become damaged during the surgical process. And it's a normal occurrence. Again, it is no blame on the surgeon, because it's unavoidable. And really, it comes down to the lesser two evils. For the disc to go out and hit the spinal cord is way worse than the nerve being pinched off. So in the end, it's the lesser two evils. But what happens is now that nerve becomes damaged. And the normal course of treatment is that the surgeon hopes and tells the patient that hopefully feeling, and it will come back. That's what they say, it will come back 6 months, a year, 2 years, but really they don't know, because what they're hoping is that nerve regains back feeling and functionality back. And so what happens is the longer they wait, the worse the problem and the harder it becomes. So if you had a patient that had lower back surgery and they had neuropathic symptoms, either immediately or even at some point, the minute they start feeling that symptom, it tells us now that there's been some structural damage done to the nerve, that the nerve has to be dealt with properly.